on my own behalf, on behalf of the political leadership of the municipality, first of all, I want to congratulate the 165 graduates for having fulfilled the requirements expected of them to become true. Congratulations, can all of us clap for these graduates? I want to thank all the benefactors of these graduates, the Global Fund, the Head Support Organization, the Ministry of Health, the trainers, and all those who did what it took to make sure the 6 months training was executed to the last detail. Thank you, the benefactors of the graduates. I want to thank in advance the government of the Republic of Uganda for having thought outside the box to make sure the tools are invented as a supervisory mechanisms for the VATs. I've not heard about it before. This is my first time in the last 4 years I've heard about tools. This is an invention from the Ministry of Health, from the government of Uganda. I want to thank the government in a special way. If you can see before us, we have an assortment of facilities. I don't know how I should value them. I have not ridden a bicycle since 2000, so I don't have the exact value of the bicycle right now. But these are very good facilities to supplement your engagement in the parishes, in the villages, throughout Ketgum district, and throughout Ketgum Municipal Council. Can we clap for the Ministry of Health? Can we clap for government? Can we clap for the cabinet where Bear sits? I think in one way or another, Minister Bear Lillian could have contributed in engineering the mechanics which led to the presence of this facility. Minister Bear Lillian, we are grateful. In most cases, people think anything government comes at the same time. No. We have 196 local governments in Uganda. I repeat, we have 196 local governments. This includes, in fact, more. If you go to lower local governments, we are almost 700. But the 196 I'm talking about are the municipalities, districts, and city divisions. The 196. So don't think any government program comes in a supersonic way and simultaneously. No, it doesn't. Program recommended, yes, program recommended. Don't you want to watch it? Let there be light. The stars and the sun came at the same time. The sun and the moon and the waters. They came through only one command of God. Let there be A, B, C. But in government operations, because we always don't have enough money, even the US government don't have enough money. Not so. Program simultaneously, that is not right. Simultaneously, cannot build our children. Iwajiwune was almost not there. No, this was the DG. Ketgum's name was not there. But eventually it became there through some political force. a political force. And I think Abe pushed that button so that we become one of the first started, let me say, to be precise. Are you not proud of that? Are you not proud of that? We are being a poor picture, Ipuro Badewa. Ipuro, Kappa, the good bear, Jalijan, Ipuro, the man telling war, Unian Loka, Unian Bear, and children, we will really complete this. Lutua training me do me abicheli probably in my yard. I made to understand several doctors, senior nursing officers participated in training you. Real curative health professionals were engaged for 6 months. Were you resident or non-resident? Were you resident or non-resident? You were resident. They were resident. That means you were taking breakfast, you were taking lunch, and supper, or dinner, evening tea. I think this 6 months training was very expensive. If we have to quantify the amount of money used by the state and the Global Fund to make sure this 6 months exercise is executed to the last detail, it could have cost almost $500 million shillings. I presuppose. Can you clap again for the state? So you are a quasi medical practitioners. Yeah, I think I used the right English. You are quasi-medical practitioners. Because 6 months training deserves a certificate. Is that certificate there? This is certificate of attendance. It's not an academic certificate. But even though that certificate is very useful to make you attend a job, I'm only requesting you, apart from this attendance certificate, you consider enrolling for a full-time medical training. I repeat. Apart from this attendance certificate, that is not right. You are now taking a trajectory of medical training. Please, if that is your calling, you can now enroll for full-time certificate. You can be in nursing and other related medical professionals. Is that clear? That you will need certificate, KTI, you'll be up here, and any, you'll be one. Since you will be at home, you'll be getting some money. I have been briefed you will get approximately $250,000 per month for the next 1 year. DG, I think the contract of these quasi-professionals have to be renewed after 1 year. Because I'm made to understand the contract is 1 year, it has to be renewed from time to time because health is wealth. Man, don't you have a very strict job description. I'm made to understand you mobilize community for preventive health services like immunization, family planning, health promotion, sanitation components, you supervise VATs and all that. So you have a lot of work. You will work hand in hand with the VATs to make sure we achieve the expectations of the district health team. I want to say something small, especially on our medical services in the district. I am happy we have the DG and the commissioners. It is the first time I'm meeting them at the distance of a stone throw. The other day when I was in Speak Resort, Munyonyo, in a joint review mission, you were not there. If you were there, I did not see you properly because we had the Permanent Secretary, Dr. Twine and Dr. Olaro, who is the DG, and several high-profile professionals from the Ministry of Health. Minister Lydian, I told the government of Uganda that Kigum Government Hospital is one of the most dilapidated hospitals south of Sahara and north of River Limpopo. I repeat, I told government in the presence of donors that Kigum Government Hospital is one of the worst possibly in Africa. Starting from the gate, going to the compound, and even the mortuary, even if you die, you don't rest properly in that mortuary. Is that right or wrong? If you make a comparative analysis between Kigum Government Hospital and other affiliated hospitals which were pre-independence and post-independence hospital, Kigum Government Hospital is one of the worst. I am relatively happy that government wants to make an overhaul, because that's what the PS told us, that there is plan to overhaul Kigum Government Hospital. I don't know what it means, overhaul. Maybe you can serve your dictionary, but overhaul means total change. That means we have some facilities of 1938. Yes, we have houses of 1938 in this hospital. Those are facilities, as the mayor, I condemn those facilities using the building rules. Those facilities have to be condemned. They are not worthy. I hope the 1 billion shillings, which I don't know whether it has started work or it is coming in 26, 27. DG, has it started work or it is coming in 26, 27? That is what I was told. That money is still not sufficient because we also need storage facilities in this hospital. This is not a yellow district. The mayor is not yellow, but I want to affirm to you, this is a yellow district. We need high-profile facilities in our government hospital. We cannot support the president for nothing, no way. You go and tell the president we cannot support him for nothing. Secondly, there is a policy statement that guarantees that political constituencies like Chua East and Chua West and Kigum municipality should have a health center for. I am disturbed. The government is only considering rural health facilities and totally neglecting urban health facilities which are high volume of nature. In terms of our OPD recruitment on a daily basis, we are now competing with Kigum Government Hospital, Espandon Health Center 3. But you are not ranking us as still a Health Center 3. That is ridiculous. I condemn that, DG. That's not right. Because the number of OPD received by Okwera, we beat them. We beat Okwera. We beat Muchini, which is a health center 4 now. We beat Kigum. Why must you continue keeping a political constituency like Kigum municipality with a population of over 100,000 people only to have a health center 3? That is not right. I hope if Pandwong Health Center 3 is elevated to Health Center 4, possibly the quality of services will improve. Currently, I have a principal medical officer, one of the only few health center 3s in Uganda with a principal medical officer. Which one are there? A few. It is my humble appeal to the Ministry of Health that even if we are nearer to Kigum Government Hospital, That is not a ticket for you to continue keeping us at Health Center 3. Because the reasoning now is, anyone who is going government hospital, take a yellow wrong where Health Center 4. That's the reasoning of the Ministry of Health. That reasoning is not right. Because we attract customer base from the entire Chua West, areas of Amida, areas of Nabon, and Akwan. How I wish in the next batches of ambulance, which is about to arrive in 2026, is it an offense to offer one ambulance to Ketum government hospital, to Ketum Panduan, is it an offense? We are using ambulances which are medieval, primitive in nature. The current ambulance we are using, mostly these are parliamentary ambulances which lacks basic facilities expected of Ministry of Health. So I am humbly asking that, please donate for us an ambulance in the next batches of ambulance which is coming. Lastly, remember HIV/AIDS is still there. You the choose. HIV/AIDS is still there. As we go towards Christmas, and even your parents, remember HIV/AIDS is still there. The ABCE strategy still stands. You abstain, but none of you here is competent of abstaining. If you are not competent of abstaining, be faithful. Very few men can be faithful. If you cannot be faithful, you religiously use a condom from time to time, from start to finish. If you cannot use a condom, I don't know, and if you happen to be pregnant, you go for earlier in the medical facility so that the elimination of mother to child transmission is executed.